えーっと、ライブになりました。
We are live. Ladies and gentlemen, good evening if you are joining us from Asia. Good afternoon if you are joining us from Europe or Africa. And good morning if you're joining us from the Americas. Welcome to Kenji Ojima's YouTube Live International. My name is Robert. And as always, I will be your MC and guide on this hour-long journey of learning. And joining me is Dr. Kenji Ojima, world-famous orthodontist and Invisalign Black Diamond provider. Also, devilishly handsome man. So,
Thank you.
Kenji, how are you today?
Hello, Robert. How about you today? It's a
I
wonderful
am
day.
doing very well. It is a wonderful day. Today, the weather was very nice. I spent time outside.
Oh, outside.
Yeah, I have a dog, so I went to walk the dog, and that was a very nice a break.
Wonderful.
Yes, it was great. It was great.
But today is just a little bit hot, right?
Yeah, it was a little bit hot. Earlier this week, it was much hotter. It was almost 34 degrees earlier this week, but today it was not so bad. There was some wind. It wasn't bad. It wasn't bad. I was happy outside.
So normally, this season is very good for the sports and go to hiking. The
Right.
best season in Japan, right? This
Right.
season.
Right, for sure. I am a big hiker myself, and this year not being able to go hiking has been a very difficult sacrifice for me.
Yes.
How about you, Sensei? Do you do outdoor sports?
Today?
In general, do you like to go hiking?
No, so I'm normally is go to the bicycle, so the cycling,
Nice.
and some of the time is I want to play the golfing like this season.
Right. Right. Well, we're all making sacrifices
Yes. How about
in
you,
order
the
to keep the
Robert?
world
Do you
safe.
play the golf?
No, my brother and my father are both big golfers, but I am not. I play disc golf. Do you know
Disco?
disc? Yeah,
I don't know.
you take a frisbee and you throw the frisbee at a special goal, and it's similar to golf, but there's no clubs and there's no balls. It's very
Just
fun.
using the hand.
Exactly.
Wow. This is the
Maybe I'll take you sometime.
wonderful. It's very famous in United States.
It's a minor sport, but there are many players. There is a professional league. There's a
Wow.
professional tour. So yeah.
It will be so you're a boy is growing up. You can play your family, right?
Yeah, it's a family-friendly sport, very easy, very low cost, which is nice, and I absolutely enjoy it. I absolutely enjoy it.
Wonderful. That is not only a sport. Thinking about the brain, tactics. Wonderful.
Exactly. Yeah, there's strategy, there's physical movement, there's fun. It's a very fun time. I played a lot in the United States. I still play sometimes in Japan. So
Sometimes it's very good for the playing in Canada, right?
yes, for sure. Canada is a wonderful place for disc golf. Absolutely.
Disc golf is only how I say play the family and play the friend only this or sometimes practice from school.
Sometimes there's practice. Actually, at my current university, I'm planning to start a team, a circle, and a team for disc golf because my prefecture, Saitama Prefecture, has several very nice disc golf courses. So
Disc golf course in Saitama Prefecture.
Yeah, and in Tokyo as well,
Wow,
and in Chiba. Yeah.
I have to learn.
I will teach you,
Thank
just like
you.
you teach us every time on these YouTube Live Internationals. Ladies and gentlemen, we have about 13 viewers now. Thank you all for coming out and joining us. I'm sure we have some regulars. If you'd like to say hi to us, please make sure you say hi in the live chat. Remember, this is an interactive session, so you can always give us your comments, give us your questions, give us suggestions to make this a better learning experience for you. Of course, right now, the world is still struggling and will likely continue to struggle with this strange situation for a long time. Many of us are finding ourselves stuck at home, unable to work, unable to go to school, and looking for a way to make a better use of our time, maybe add some learning and enrich our lives. And we are so, so very thankful that you have come out and decided to do that learning with us. Because of you, Kenji Ojima's YouTube Live International has reached over 8,000 views since we started just 3 weeks ago. It's amazing. Kenji, do you believe that? 8,000 views?
That's amazing, right? That's amazing,
really
yes.
Yeah.
So this year held in the webinar from American Association of Orthodontists. At this time, over 10,000 watchers. That is more biggest, the huge conference room, right? Normally 1,000, 2,000 is a very big conference room, but webinar is amazing.
Yeah, 10,000 people, not having to worry about seating limitations really changes the situation. Well, hopefully the audience and the presenter enjoyed this new format, and hopefully our audience enjoys this new format as much as we do. I certainly enjoy doing this 2 times a week, and I hope that they enjoy watching us. So, Kenji, we have 2 different cases today,
Yes.
Correct?
Exactly.
What is our first case?
Today's first case is high canine anterior crowding. So this patient is a very severe crowding. So normally, which is better way, extraction or no extraction approaching. But very difficult one is some of the time is many of the orthodontists think about which is better way or not. And another one is open bite case. Open bite is one of the very difficult approaching, but we have to think about which is better way. Yes. This is the 2 cases, okay?
Okay, cool. And not last week, but in our last session on Wednesday, we had an Invisalign teen case that was non-extraction and had very amazing results. So I'm looking forward to seeing the results of today's case.
Thank you. So now I will show you.
While you're finding your file, I'd just like to say hello, Cisco Fidel. Thank you again for joining us, and thank you for your wonderful comment. I'm glad that you have become a regular, and I hope you continue to be a regular participant in our live sessions. Thank you so much.
Thank you.
Kenji's magical skills.
That is everybody understood what is very important thing is a very simply. Yeah. So I will show you this case. Okay. Choose fine.
We have another comment from Razan Suleiman. Hello, Dr. Razan. He says, many thanks to you, Dr. Kenji.
Thanks a lot.
Razan says thanks to you. Yes.
Okay, let's go.
Okay, let's get started.
This patient is a teen, class 2, high canine, the midline shift. So the age is 14 years old, female patient. The problem is this. Problem is the how to correction curve of spin. Okay. The curve of spin means is that we have to need vertical control. Vertical. For teenager orthodontist, very important thing is 40 years old female patient. The big key of the success is part one is growth. And the last time I told you, so the aligner orthodontic is a good control, effective to control of molars. And if we can try to more faster, some of the time we can try to avoid extraction or not. This patient we try to 14 years old. This is the initial situation for this patient. So as you can see, this patient is midline is deviation And the upper right side canine, very high canine, cannot bite. And no space for alignment. And the lower midline is deviation to the left. And the lower side and the upper side, both of sides is not good occlusion. And just a little bit canting, okay? This is the initial situation for this patient. This is facial photos. You can see upper midline is just a little bit deviation to the right. The lower midline is just a little bit deviation to the left. Need the correction for this patient. This is an OPG and safe. You can see this is a very young girl. Not eruption to the wisdom tooth, and this is a very small jaw. Some action. Everybody is thinking about some of the time very small jaw way, but we have to think about the growth, and we have to think about what is better final situation. So the very important thing is a thing like for my planning for the like this situation. So this patient we have to need lower molar intrusion. Then we have to go leveling of the curve of speed. At this time, we have to do the intrusion, the molar lower side. Intrusion. This is a curve of speed for this patient. Then so intrusion, the lower molar. Then after that, extrusion upper molars. This is definitely vertical control, only aligner orthodontic treatment.
Interesting.
Yeah. Then so this is a flat line, totally different. Then we have to need upper side is extrusion. So of course, before tooth movement upper, lower control is done. That is very important thing. Initially, intrusion and lower molars, then follow to the upper molar extrusion and upper canine extrusion. Lower molar intrusion first, then tooth movement. This is clean check. This is a migration, and we have to need a space create and alignment is, then expansion upper and lower arch, then finally intrusion and lower molar, after that upper molar extrusion. Okay? Go back to here. Expansion and the midline is correct. And the distalization, intrusion the lower molar, after that upper molar extrusion. This is my clean check for this patient. Expansion segmentary, expansion lower side is simultaneous. After that we have to need uprighting and intrusion. Aligner leveling, vertical control, lower molar intrusion, then upper side is extrusion. Okay, that is for the initially is we use class 2 elastic, then molar distalization, both of sides. And this time we choose is a class 2 elastic, lower first molar to upper first premolars. At the same time, using for the bite force is a lower molar is intrusion. You can see intrusion, then create a space and between upper molar and the lower molars. Okay, this is create a space, then distalize, expansion and alignment arch. You can see upper right canine is alignment, and this is a total control situation. The detailing to finishing. So the all for the leveling is achieved. This is a biomechanics placed on the aligners. Then this is uprighting, distalization, extrusion, alignment here. You can see canine is going to class 1 relationship, both of sides. This is the finery. The finery is both of sides class 1 relationship, midline is correct, arch coordination is good, and facial midline and dental midline is correct. This is the final situation for this patient.
Excellent.
Thank you. Then so all the time that is very important thing is aligner with fitting is better. The fitting is better, we can do everything. You can see initially aligner only, then place on the attachment, button and the hook, then started for the expansion and started alignment and intrusion of lower molar, follow up upper molar extrusion, then create a space, then upper right canine is alignment, then finally is sole control, then finish. This is all the time is a treatment procedures. We have to check precisely. This is OPG and safe. You can see root parallelism is perfect and no root resorption. This is the final situation for this patient. The smiling is good. The smile curve and the lip curve is almost similar, and the midline, the facial midline and dental midline is correct. This is end of the treatment time for this patient. This is a comparison initial and the final. And we can treat is alignment, the vertical control, and the midline is correct, and the canting correct. Everything we do aligners.
That's fantastic. Absolutely excellent. So how long did this treatment take from beginning to end?
Treatment time is around 2 years. This
Around
is
2
a
years.
2 years retention for this patient.
Wow, a fantastic, fantastic case. Thank you so much, Dr. Kenji Ojima. Starting at 14 years old and extending until 16 years old, and trying to plan for the growth that happens in that space must be just an absolute feat. Well, as you can see, Kenji has stepped away from camera for a moment, so you are with me. Once again, I'd like to take this moment to thank everyone for coming out and joining us. If you're joining us late, there are about 30 of you in here now. There were far fewer when we began. Welcome to Kenji Ojima's YouTube Live International. My name is Robert, if you have not met me before, and I am here with world-famous orthodontist Dr. Kenji Ojima, who will be out in a moment. If this is your first time joining us on the channel, please take a moment to hit that subscribe button. By hitting subscribe, you build our follower base, and by building our follower base, you make us available for more people. Also, hit like on this video as well. By hitting like, that thumbs up button, you make us more visible to people who are interested in our topics. So people who are interested in aligner orthodontics will be able to see us more easily. Please take a moment to hit subscribe and like. This was an absolutely amazing case. I hope that you were as amazed by it as I was. And Kenji is now back.
Thank you.
So welcome back, Kenji.
Okay.
So let's get into our chat.
Okay.
And take some questions and comments from our audience. So we already said hello to Cisco. We said hello to Razan.
Hello.
And let's say hello to Sagar. Hello, Dr. Sagar.
Hello.
Dr. Sagar greeting us from India. Wonderful. And then we also have a message from Dr. Palaniappan, who says, Hi, otsukare-sama. Otsukare-sama. Fiona is back. And
Good again, Fiona.
Hello, Fiona. Thank you, as always, for joining us. I believe maybe we didn't catch this question in our last live. She tried to ask this one for you as well.
Okay.
At what interstitial angle do you end your cases?
So it's very important thing. You can check for the cephalometric analysis. Then you can check for the how millimeter is how degree is better for this patient. You can easy to checking from cephalometric analysis.
Right, so the interstitial angle depends on the situation of each patient, correct? Okay, fantastic. All right, Sagar has asked us a question, which is down at the bottom. Okay, and Sagar's question is, let's see, how can we know that the canine is moved successfully to its optimum position? And what are the chances of root absorption with the upper canine?
So my opinion is for specialty aligner orthodontic is not to the strongly continuous force. Then this is avoid for the severe root resorption. So this case, of course, this case too, and avoid root resorption and prevent for the gum recession. So that depends on your planning. Planning is very important thing initially. So many of the orthodontists specialty using Invisalign system focus on green check only. That is very dangerous. The very important thing, my suggestion is you can use for the cone beam CT before the try to create your green check. Then so you can understood for the watching for the bone situation, watching to the your patient root, then how millimeter, how degree is possible to the movement. Then you going to integration to your green check. That is more safety. After that, so that your patient and the canine control and the root, not too problem for the root resorption, some of the time gum recession.
Okay, and how do you know that the canine has reached the optimum position?
How to reach?
How to know that the final position is best for the canine? How do you understand that?
The 3 point, that is very important thing. The one is the face, so the integration, the position. Because of course, very important thing is tooth is not only tooth. This is a the face integration, the tooth. That is very important thing. You have to understood the face, then go back to the teeth. Then how millimeter extrusion is better to this patient. This is the one. The second one is a coordination for the arch. The center incisor, lateral incisor, the canine. This is a coordination of the arch. That is very important thing. And the third one is symmetry. The right side, left side is symmetry is more beautiful. If right side is this, the left side is this, it's not good. So we want to control the symmetry and the midline and the curve of the arch. This is decide on the position for the optimized position.
Very thorough answer. Thank you very much, Kenji.
Thank you.
And thank you for your great questions, Dr. Sagar.
Thank you, Sagar.
Okay. And we have a question from Dr. Cisco. Hello again, Dr. Cisco.
Cisco, thank you.
And Cisco says, Class 2 elastics cause extrusion of molars. What mechanics are used to counteract and intrude the lower molars?
That is very nice question, Cisco. Class 2 elastic is just for the additional anchorage, just additional anchorage. But more strongly force is bite force. Aligner, we can use patient bite force more than strongly force because normal bite force is about 40 kilogram and the more strongly one is sometimes 80 or 60 kilogram. That is more strongly force. The class 2 elastic is some of the time one with anchorage, but the patient using bite force at this time, so lower molar is easy to intrusion because the aligner appliance is covered to occlusal aspect, then easy to pushing on the lower molars. This is a totally different for the biomechanism for the wires, braces, specialty aligners. That's a very nice question.
I see.
Thank you.
Yeah, definitely. So the bite force is stronger than the elastic force, and therefore it's not. You don't have such an issue with unintended extrusion. Okay, and we have another question from Tamara. Welcome back, Tamara. Nice to see you.
Nice to see you.
Hello. He said, Tamara says, "Konnichiwa, sensei."
Good.
And she also says, did you also do IPR in this case?
Yes, for the very slightly, very slightly. I like for the using IPR is a just final situation. I don't like for the initial situation additional IPR because initially you can see this patient is a very clouding anterior teeth. This is the initial situation. This is very, very dangerous and difficult to approaching. And as you know, is a young generation is very thin for the enamel. The pulp is very big. That is specialty this generation. So I don't like for the initially the big IPR. I don't like it. So finally, I want to correct slightly midline. At this time, just stripping is better. But a very nice question.
Okay. Thank you very much, Tamara.
Thank you.
And CMY is back with us again. Hello again, CMY.
CMY.
Hello.
Why?
Why? CMY says, hello, Dr. Kenji and Robert.
Hello.
Do you have any do you have any protocol to close posterior open bite at the end of aligner treatments?
So the CMI, thanks a lot all the time. Wonderful question. So the specialty aligner orthodontic and the finishing time posterior open bite. What is this? This is my idea is a fourth thing. Is a very strongly overjet overbite and the torque control, premature contact, and some of the time is how I say we have to need the curve of speed leveling. Some of the time extrusion, the more extrusion, the more they good for the correction. For the, like this patient, you can see all the time the treatment procedures is intrusion the lower molars, then create a space here, then after that extrusion you can see like this. So the very important thing, which tooth is contact, which tooth is premature contact, okay? You can see contact is all the time is good, right? So there are many of the doctors talking about aligner easy to happen to posterior open bite, but my idea, my opinion is no. So you have to check precisely which teeth will be happen to posterior open bite, and another hand is to think about anterior contact, anterior guidance. If more strongly torque control, easy to happen posterior open bite. You have to think about anterior position, torque control, anterior guidance, think about premature contact. This is a very important thing. Okay?
Excellent. Thank you very much. We will be talking a bit more about open bite a little bit later, but thank you as always for your wonderful input, CMY. Okay, we have another question from Dr. Sagar. Dr. Sagar says, sir, what about the soft tissue musculature force in this kind of case?
Musculature force.
Yeah. Force from the muscle. Does it counteract any of the aligner movement? Does it interfere or add to the treatment in any way?
Yeah. So this patient is not too much because a very young generation is not have a bad habit. Is some of the time is posterior. Some of the time open bite patient and a very narrow patient is we have to need muscle training first. But if needed muscle training patient, is aligner is a very good support for the muscle training, because the aligner is insert, aligner is more create for the expand. At this time, for the easy to same time muscle training, very similar to flanker appliance, flanker. But this patient is no, very young, very small girl initially, but this patient is no.
Okay, wonderful. Thank you very much for your question, Dr. Sagar, and your answer.
Thank you, Sagar.
Dr. Kenji. We have a question from Dr. Konstantinos. Welcome back, Dr. Konstantinos. Thank you for joining us. Says, hello, Dr. Ojima and Robert. Hello. Are there any more tricks to use a part of the attachment on tooth 13 to prevent disengagement of the aligner in this area?
So very important thing is very nice the point of the view, Constantino. So okay, I will show you. Okay, go to here. You can see initially the upper right canine 1-3 is no place attachment, the same protocol for me. Then the place on the like this is a rectangular attachment. After create a space, then started to extrusion alignment. In this time is a place on the bottom cut, same time. Then, okay. This is not to the specialty approaching, so just thinking about which tooth is anchorage, which tooth create a space, after that going to the canine light position. So the place on the attachment is we have to need is perfect. Remove the bodies. That is very important thing. So specialty control. You want to control the canine. I definitely recommend if you place on the attachment, please use a loupe. If you use a loupe, you can see everything. They remove the body completely perfect. That is my secret weapon.
Your secret trick. Well, that's fantastic. As usual, a tip that you can only get here in Kenji Ojima's YouTube Live. Well, it looks like we have run dry on comments and questions for our first case. Thank you all so much for your feedback. If you haven't done it yet, please go down and hit the like and subscribe button. Hitting subscribe helps us grow our fan base. Hitting like helps us get our message to people who enjoy the same kind of content as we create. So please hit like and subscribe. Oh, we have a greeting from Dr. Natalie Venari. Hello, Dr. Natalie.
Hello, Natalie.
She says, thank you, Dr. Kenji, and I'll see you next time. So hopefully you come back and join us again soon, Natalie. Okay, so Kenji, what is our second case today?
Okay, let's go to move. Next one. Next case is an open bite. Open bite, yes. So initially, I want to introduce for this article. This article is published on the 2019 last year. So the very new article. So my mentor, thanks a lot, Professor Labinanda and our team is published on this case. This article is very simply introduction for how to approaching is a type of the open bite. So biomechanics is totally different, every single level. This is, now I explain for today, this one is including this article, okay? So the initial one, this patient, 25 years old female patient, open bite neck extraction, anterior extrusion, but the problem is introduce the molars. How can we do introduce the molar, then mandibular clockwise rotation? So the very difficult approaching because many of the doctor already know is a lower molar intrusion is very tough, and we have to need, so very difficult to bending the wires. Some of the time easy to go using TAD. Okay, so this patient is we call level 2 approaching. Level 1 is molar side is keep it. Only anterior extrusion. So this is a level 2 approaching. So I want to introduce my mentor, Professor Labinanda from University of Connecticut, orthodontic department. So that he is a legend. He's a very famous one. Then so that I learn from him. So that what is the biomechanics? Biomechanics, that is very important thing. Every kind of the orthodontic treatment. This is. I love my favorite his article, how to treat for the open bite case. That is very important. See, the key of the success for the biomechanics for the open bite is molar intrusion, molar vertical control. This is our calling the category level 1, 2, 3, 4, 5. This is a degree of the difficulty. Level 1 is a no molar control, only anterior extrusion. Level 2 is anterior extrusion plus molar intrusion. So then maybe 2 or 3 times last my session, I explained open bite with extraction level 4 case. Today one is I want to introduce level 2 approaching, but this one is very common approaching. Okay, so now I want to share my experience to the level 2 open bite approaching. This patient come to my office. Initially, is definitely open bite. Only contact is right side is 2 molars. Left side just 1 molars. Then so the just little bit canting, narrow arch, anterior clouding, and not contact anterior side, not contact canine side, only molar side. This is a face. Definitely open bite for this patient. Very difficult to close the lip, and not good for the smiling for this patient. So this patient my planning is extrusion upper anterior and the lower anterior teeth But not only anterior teeth extrusion, that is very important thing. This patient is a level 2. I want to planning the intrusion molars, control clockwise rotation for the lower side. This is a level 2 patient. Okay, so initially, like this situation, we have to divide what is problem for this patient. Then my planning is this. This patient have to need intrusion the lower molars and intrusion the molar side, both of side. Then create a space. Then we want to control counterclockwise rotation of the mandible. Then space open bite side is closing. This is a face integration clean check. Then we understood how millimeter extrusion is better for smiling. This is my goal, the face integration clean check. Then we understood this patient 1.3 to 2.3 expansion 4.0 millimeters and the extrusion 4.0 millimeter 1.121. This is a vertically tooth movement. This time very important thing, introduce the lower molars and upper molar, then counterclockwise rotation of molars. Introduce the upper and the lower molar, then counterclockwise rotation. At this time, so the aligner very easy to control for the vertical control because I already told you using the bite force support aligner tooth movement. This is attachment with tooth movement. Intrusion the molars. The intrusion the molar side I never place on any attachment because the intrusion side is a definitely very simple force, the intrusion. Then another tooth is we place on attachment that we want to control like this, alignment, expansion, and go to extrusion. This is a very important thing. Then so that we can easy to checking which tooth is contact or not. Intrusion molar. Then so the another tooth is many of the time it's started to contact. Premolars, canine, all of the tooth. Okay, going to the clinical photos. This is my simulation. This is the place on the attachment, started to intrusion. Then you can see this is started to mandibular automatically anti-clockwise rotation. Intrusion lower molar, then started to contact premolar, both of side. Okay. Then the molar intrusion, many of the tools started to the vertical contact. This is the progress. You can see place on the attachment, then aligner is attachment fitting is better. Then intrusion lower molar, upper molar, same time is extrusion anterior teeth. Okay, the aligner fitting is completely perfect. We can do vertical tooth movement very easy. This is progress of the teeth movement. This is the final situation for this patient. Is a molar side, is a premolars, canine, is a all tooth is vertical contact, and we can achieve the midlines correct. And we alignment for the canine to canine and the arch coordination is good. This patient is without any task. This is the final situation for this patient. Smiling is good and easy to close the lip. Then this is a 2 years retention. The 2 years retention is very, very stable. It's a both of side class 1 relationship and the midlines correct and keep for the good smiling. This is a final OPG comparison, totally different, and no root resorption, and you can see we collect the curve of speed. This is comparison cephalometrics. You can see understood we can do lower molars mandible is a counterclockwise rotation of the mandible. Aligner is a very soft material and a very simple one. So many of the doctors only simply approaching and only anterior teeth approaching. But if you understood what is become aligner orthodontic, what behind aligner effect, so you can try to do like this tooth movement, molar intrusion, molar anterior extrusion, everything you can do it. Okay.
Yeah, being able to cover the entire occlusal face and apply force from multiple angles
Yes.
is really it's a big advantage of aligners over MBS or traditional bracket treatments, isn't it?
Okay. This is the end.
Okay. Wonderful. This is a life-changing treatment. Look at that smile. That's so beautiful.
Thank you.
Okay. Let's turn into our live chat. We have two questions still remaining from our first case. So the two questions from our first case. The first one is from Dr. Wen Hai. Hello again, Dr. Wen Hai.
Wen Hai.
Welcome back. Hello, Dr. Kenji and Robert. Do we need to remove the lower wisdom tooth to make lower intrusion easier?
Exactly.
In the teenager.
Exactly. But last case for the patient started time is just 14 years old female patient.
Right.
So we have to think about around 17, 80 is more easy. But for the still 14 years old this time, is a bone is very soft and the wisdom tooth is not completely eruption for the root. Not very easy to control for the intrusion of the lower molars. But when high, you are right. Extraction is more easy.
Yeah, it is definitely easier, for sure. Well, thank you very much, Wenhai. And we have another question from Dr. Vishal. Hello, Dr. Vishal.
Vishal, hello.
Dr. Vishal says, hi, Kenji and Robert. Thank you for these webinars. You're very welcome. My question is it beneficial for the patient to correct the curve of SPE in a case without deep bite?
So the Vishal is a very nice question. Thanks a lot for my question is benefit for the patient to correct curve of SPE the case without deep bite. Yeah. So the deep bite patient and any kind of the situation of the patient. So my message for this webinar is aligner you can do try to curve of SPE and vertical control. Okay, so if you want for the deep bite patient, so some of the time deep bite patient is several course. Some of the time class 2 division 2 like this. Initially class 2 division 2 is a proclination upper anterior teeth. Then so the naturally mandibular tooth movement. Then sometimes so the already just little bit correct. It's depends on the situation, but if you want to, so the intrusion the anterior teeth and correct to the deep bite case, yes, you can try to curve of SPE. The last our international webinar, I explained for the deep bite patient. If you have a time, so that you can check our international YouTube live archive. So the last case is a deep bite patient. So you can do yes. Sorry, Robert, cannot your voice cannot hear.
I'm sorry.
It's okay. Now correct.
I'm sorry. It was a setting problem. Yes. So you can go back and check that last broadcast. It was on May 6th, last Wednesday, if you'd like to see that deep bite case again. Thank you very much for your question, Dr. Vishal.
Ciao. Thank you.
Okay. Cisco. Dr. Cisco comes back and says, amazing, Dr. Kenji. Clap, 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 clap. And he says, what is the staging for this open bite treatment?
Okay. Open bite one. Case 1 is case 2, right?
Case 2, yes.
Okay. So case 2 is a specialty open bite approaching. Initially, we approaching is a focus on the molars. Focus on the molars. Intrusion is the upper and the lower molars. Then so the control clockwise rotation. At this time, specialty like this patient is very, very, effective tooth movement. But a very important thing, that before intrusion of lower molars, you can have to need a check cone beam CT, the bone situation. Every time our webinar, I explain for you, this is a bone, this is the root. If like this situation, very difficult to intrusion the molars because they already hit for the cortical bone. You have to check the bone situation and the root position like this then intrusion is you can do it. Okay, so that you have to need not only watching the screen check, you have to check bone situation, the root position, root angle, then try to your intrusion planning. Okay, after that you can do it.
Wonderful. Thank you very much for your question, Cisco, and thank you very much for your wonderful answer, Kenji.
Thank you, Cisco.
Okay, we have another question from Dr. Jin Ying. Welcome back, Dr. Jin Ying.
Jin Jin.
Welcome back. Hi, Dr. Kenji and Robert. Hello yourself. Just wondering, how do you control the black triangle and the gingival recession in expansion cases?
Okay. So the specialty anterior teeth, right? So if for the expansion case like this, then so the root parallelism like this, so easy to black triangle. Finally, I want to just little bit control root position is more tighter. Or some of the time, if we want to avoid or prevent for the black triangle, at this time we do IPR, final situation. We do finally IPR, then more space closing, then prevent black triangle.
Well, thank you for your question, Dr. Jingying. And I believe we talked about black triangle control in our Wednesday, April 29th discussion as well. So if you'd like to go back and listen to that discussion again, please do. Yes, and of course, by liking and subscribe to the channel, you can go back and watch any of our discussions. Of course, our live discussions are recorded and they remain on Kenji Ojima's channel. And also all of the cases that we show, these case studies, Kenji has them saved in his own case gallery. Right now there are 23 cases in that case gallery. They do not have narration like these do, but you can watch them again and again and again. And you can find some new questions and bring them to our next online discussion. You're very welcome, Jing Ying. Thank you so much for your question.
Thank you, Zizi.
All right. Well, ladies and gentlemen, we are almost at the end of our evening, and it seems like you are finished asking questions and comments. Thank you once again for coming out and spending the evening our time, maybe afternoon or morning your time, with us. Oh, we have one more question from Dr. Wenhai. Let's get that before we leave. Dr. Wenhai says, hello, doctor. Do you use elastic to extrude the upper anterior teeth, especially the lateral incisor?
Yeah. If needed some of the time. If you want for the lateral incisor some of the time, very difficult to gripping for the aligner. At this time, if you additional, yeah.
It's possible.
Possible.
As always, yeah. Try not to limit yourself. If you can imagine the treatment, you can do it. The rest is up to your technique and your knowledge. All right, ladies and gentlemen. Once again, we live in a crazy world right now, and there are very few things that you can rely on. But one thing that you can rely on is that Kenji and Robert will be with you on Wednesdays and Saturdays, bringing you wonderful content in English covering Kenji Ojima's amazing case study backlog. Kenji, do you have any final words before we sign off this evening?
Yeah. So then currently is just a little bit better situation for the coronavirus all over the world. Then I hope for the next year and then next weeks, yes, is become better. Then so that we can go outside. We want to the meeting for the really for years. Okay, so that we have to survive and we have to good relationship for the using online. Then so that we can more better situations, a better treatment for the better approaching for your patient, right? So I hope for this webinar is one of the support for your gift. Then so please try to the better treatment for the aligners. Then please create for the happy for your patient. Thank you for watching.
I could not have said it better myself. Thank you so much, everyone, and thank you, Kenji. And we'll see you all again at the same time on Wednesday evening, our time, Wednesday afternoon, your time. Thank you very much.
Bye-bye. Thank you, Robert. Thank you all.